Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are with Katie Beck, who is the director of the Diploma of Tropical Nursing program from the London School of Hygiene and Tropical Medicine. She's a lecturer on extreme medicine with the University of Exeter and a bunch of other things. Katie, welcome to the program.
Thank you so much for having me.
So tell us a bit about yourself and what's keeping you busy.
Oh, wow. Well, I warned you that I didn't really like speaking about myself, but I'll dig deep. So yes, like you said, I am a lecturer in nursing science. So I split my time mainly between the University of East Anglia, where I get embroiled in all sorts of things, global and international health. So I am the international placement lead for the School of Health Sciences and the global health theme lead for our new Academy of what are we calling it? Academy of Professional Development, where we're setting up a number of new master's programs in global health. So that keeps me busy. On my other shoe, I am, like you said, the course director of the Diploma of Tropical Nursing at the London School of Hygiene and Tropical Medicine, which I have the honour of delivering to students around the world. It's a global online course that runs twice a year and is really nursing specifically focused and working and kind of focused on preparing nurses to work in lower resource settings. And then, like you say, at Exeter, I'm also involved in their extreme medicine course. So that is more of a kind of expedition and kind of adventure based medicine. And I suppose I've come to that. I don't really know how I've come to it, to be honest. It's been a long, old, winding road. But I could summarise it by saying that my background is in nursing, mainly acute nursing. And I've worked around the world in multiple different low resource settings, both kind of from the ground level in teaching hospitals and district hospitals. But also spent a significant amount of time working as medical lead for an international development charity, where I had the pleasure of working with lots and lots of nurses and medics and also kind of international volunteers. I think probably oversaw the safety and well-being of about 6,000 volunteers in my time there. And supported a lot of medics going through their kind of first experiences of global health. And so I feel very privileged because I feel like I haven't just experienced it myself, but I've kind of learned from all of their experiences as well. And that's kind of all filtered through, I guess, to my current research and teaching.
So that's a very broad background, and I completely understand why you're sitting in the chair where you are leading the Diploma of Tropical Nursing to get nurses to do what you've done.
Well, maybe, or something similar. I definitely, I've seen the good, bad and the ugly, I think, of international health and global development. And I encourage my students to approach everything they do with a certain skepticism. And increasingly, I'm actually all about the kind of thinking global but acting local movement. So yes, I wouldn't say that I've stepped perfectly through my path, but I do very much still enjoy engaging with these issues and engaging with nurses who have aspirations to do something similar, at least.
So I am curious. Tell us, where have you worked? What's your favorite country you've been in? What's a challenging country you've been in?
Oh, wow. I don't know. I'll go with my gut here, and I'll go with Borneo. So I spent 6 months as a kind of expedition medic on a environmental project in kind of the deepest, darkest primary rainforest of Malaysian Borneo. And it was just such a magical time. I think I was quite young and I was relatively unencumbered by the really big questions and kind of academic underpinnings of my work. It was actually a really good in terms of a kind of impact and evaluation, a really good, well-designed project. But just the environment was wonderful. We got woken up by gibbons in the morning, and pygmy elephants would wander through our camp and steal our biscuits. And we were living in a hammock. I didn't go inside. I didn't see a house for 6 months. I was really properly back to nature. There was exciting nursing and medicine to be had. So there were all kinds of kind of ailments, relatively minor on the whole. It was really where I honed my trade as an expedition medic, I think. But also the project was fun. The people that I was with were fun, and you really get a new perspective when you spend every night around a campfire, and your immediate concerns are just what's in front of you. You're not bogged down by the trials of daily adulting.
For the Borneo trip, did you feel prepared? Did you have any other training besides your nursing degree program?
Let me think. When you look back and you can't remember the order in which you did things. So some of the best preparation that I've had for expedition medicine is not medical. It is my mountain leadership qualification, which is perhaps the qualification actually in life that I'm most proud of. Don't tell my academic colleagues that, but that was an exceptional qualification to have to prepare you for looking after yourself in the wilderness and looking after groups in the wilderness. And I did have that at that time. I think that was very good. I was also very careful about the organisation that I was employed by, and I ensured that there was adequate support and protection in place for me where I felt that I was challenged in terms of scope. And actually the scope that I had was very clear. One of the kind of freeing things was that the medical was only so big, right? There are only so many things you can do before you have to make the call to evacuate. So in a way that was quite reassuring. And whilst, it was back at if anyone's ever been to Borneo, and the Borneo rainforest, sat phones, total nightmare. On the equator, they work less well anyway, and then you've got a massive canopy of trees, which means that you can't use sat phones very well at all. So we had to rely on radios. So we would radio into field base twice a day, which was very disconcerting, I guess, for us now who are used to 24-hour communications. But actually, despite all of that, and I don't think it was the arrogance of youth, I did feel prepared and I did feel confident in that situation. But it would have only taken a few things to be different for me not to be. And so I think the organisation that I was employed by really made a huge difference to that, and the support and the training that they provided me with.
Well, to be fair, the mountain leader training is not an easy task. It takes months. Tell us about what you went through to get your mountain leadership qualification.
I suppose on paper it's not that big a deal, but it's the actual commitment to it. Especially, I live in a very UK city called Norwich, which is about as far away from any UK wilderness that you can get. And one of the requirements of the qualification is that you accrue, I think it's like 25 days, what they call quality mountain days before your training, and you have to log that. And there are certain requirements of what a quality mountain day looks like. And then you go and do your training, which is like don't quote me on it, but I think it's like a 4-day course when you're kind of beasted around some hills. And then you have to accrue 20 more what they call quality mountain days to demonstrate your kind of proficiency and independence in these type of environments before you go and do your qualifying assessment, which is another 4 or 5 days again of kind of being expected to look after yourself in the hills. You do things like night nav, where the assessor will point on a tiny, with a blade of glass, they'll get your map out and they'll point to a tiny location with no distinguishing features, and they'll say, take me
Hmm.
there in the middle of the
Nice.
night with no, with no artificial lights. So yeah, it's good fun.
That's a bit of special forces training because that's what we did all the time.
Mm. Yeah, well, I mean, what can I say? They're missing out.
So to become a mountain leader, they require a remote emergency care course. Did you get to skip that since you're a nurse?
I did not. I did go and do one. Now I can't remember if I think I did have the option to skip it, but what I was interested in is what the expectation would be for non-medical leaders. So I think I went to it just kind of out of interest, really, to see what the threshold is, because I think what I've noticed very much working with other medics is we do have a tendency actually to over medicalize things that don't necessarily need medicalizing. And so I kind of wanted to see it from the flip side. And I did think it was quite useful, actually, and interesting.
So you talked about your favorite country, Borneo, and talk to us about a challenging country. And you don't even have to name the country if you don't want to, but what was a challenging situation for you as an austere nurse?
Challenging situation. So I think most of the most challenging situations I have been in, it has not been a glamorous case of acute illness. It's been more of a chronic case of cultural competence and communication. And so I think some of them, so for example, working in a hospital in Malawi, um, there were some, it always takes a really long time to accustom yourself to it if you're working within a local service. So I'm not talking about kind of situations where you're, almost like MSF or roving clinics where you take everything with you. You are the health system essentially, and then you take everything away again when you go. I'm talking about slotting in to pre-existing health systems. And I'm of the opinion that that's always harder for someone coming in. And it's also, but also, I think perhaps, I don't know, there's arguments to say that that's a more sustainable and ethical way of approaching things. But it does really lead, I usually go away from those situations with more questions than I have answers. I usually go away from them with big questions about my role and my place and, the kind of ethics and the impact of what I'm doing. And that can, so small example. I remember working in a maternity unit in Malawi. And, just to paint the picture, small clinic, people giving birth next to each other, limited privacy, really expert midwives who are just run out of their feet with delivery after delivery, thin dividing wall between delivery suite and prenatal clinic where women are lining up to have their prenatal checks. And it was entirely normal practice whilst a woman was labouring for midwives to kind of slap the women well, I mean, I'm not entirely, my perception was either to stop them from screaming because they would be scaring the women next door, or to kind of get them to focus. I'm not really sure. I asked, I'm sure, on various occasions and got various answers, but getting to the root of it was really, really difficult, and it really challenged me because one of the deepest values that you kind of have as a healthcare practitioner is to do no harm. This was a really it went against everything I believed in, but how to approach that when you have to continue working with these midwives, you are new to the environment, you have kind of no context on the background to why this might be happening, and you have limited resources to try and understand it. Really, 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 really difficult. And I actually use that example on the PDTN as a kind of ethical dilemma, and it's a relatively small one, but I would come against them day in, day out, and that kind of places that I suppose moral fatigue and that kind of level of questioning constantly is challenging.
So you've worked in a lot of places. How many countries have you worked in now?
maybe 8 or 9. But I don't always think it's about collecting countries. I know you can have worked in 1 or 2 countries and to have a really good quality experience, and you can work in all of the countries in the world and not create impact. So I do occasionally, I'll put up a map with dots on it, to my students to show how I've worked, but I'm always a bit hesitant about doing that because quantity doesn't necessarily amount to quality.
Have you done MSF work or other NGOs?
No, so I have not got experience really in humanitarian work. So all of my work has been more around, kind of expedition type medicine in the context of sustainable development and environmental projects or health system strengthening. So other than some kind of research I've done with other nurses that have experience in NSF, limited humanitarian work actually. But I think that's some of the real fascinating thing about my position on the PDTN is that I get to learn from nurses. There are fields within nursing and for other healthcare professions as well that you didn't even really know existed. But when you trained, or even when people come to the course, all of the work, for example, in health and security and occupational health, people often don't think about before they come to the course, and then it's really it opens that whole world up to them. So lots of different pathways.
I can understand your interest into the extreme medicine. It's a different ballgame, and often you're on your own, where MSF you may have a better support network.
Yeah, absolutely. And the same with kind of health system strengthening. I think, I don't know, expedition medicine, it depends. I mean, there are lots of different guises and what is an expedition really, I guess. But you'll notice a trend in what I talk about here is that I also remain conflicted about expedition medicine. I love it. Personally, I love it. It's so much fun. The adventures that you go to with this small team, and you're really you're achieving what feels like great things. But there is an element of discomfort within that, especially because very often it's very privileged groups of people kind of making a playground of less privileged areas of the world. And that's not to, I think there are ways of doing that responsibly and perhaps even sustainably. And there are ways of not doing that. And I think in my time, I've kind of got a good idea of models that I think work. And one of my favourite things actually about the Borneo expedition and about a number of expeditions that I've done in Nepal, for example, is the inclusion of local participants. So in Borneo, half of my group were international. So we had, participants from the UK, from America, from around the world. But half of them were actually Malaysian young people. And I think the value that contributed to the whole experience for everyone and the impact that the project had was huge. And I really like that model. It's something that I would really like to kind of replicate really on the PDTN. I love the idea of that kind of reciprocal learning and buddied learning across cultures.
You mentioned that for your East Anglia experience, you're part of the international placements. So
yeah.
So you put nursing students out and about, don't you?
Yeah, we do. Yeah, we've got different partners. We take a partnership approach to that. And again, it's one of those things that international placements for healthcare students is quite a well-established kind of almost like a rite of passage for undergraduates in the UK, particularly on medical programs, but increasingly on nursing and allied health professional programs. There are ethical and sustainable ways of, or more ethical and sustainable ways of organising those kinds of placements, I think, and conversely, less ethical and sustainable ways. So my aim, really, my vision for the programmes delivered by UEA is that they are really well designed and evaluated programmes which foster at their heart this kind of spirit of partnership. So we have a number of partnerships across the globe that our students can participate in. I've just got back from Zanzibar, working with an organisation called Knowledge for Change, who've got a brilliant model of partnership working. International placements for student nurses aren't all they do. They do a huge amount of other project work, and they kind of have recognised that they've created this really good environment for student nurses to participate in. And so they offer that opportunity. And so, yeah, I had a lovely time meeting their staff and seeing their projects there.
We have the same approach here at Quorum at the college, that the placements must be ethical, must be mutual. So mutually beneficial. So earlier this week, I got back from also Tanzania in the Kilimanjaro area, and we have been sending students down there to KCMC for a decade. And I hope that we are giving more to KCMC than they are by hosting our students. We've donated ultrasounds. We've donated tens of thousands of euro of support to help buy things. And like two of our master students were out of their own pocket were fixing up an ambulance, and so they can have a critical care transport vehicle, because there's no EMS in northern Tanzania. So you're right. There has to be a quid pro quo. There has to be a mutual benefit for both.
Yeah, and it's that recognition, isn't it? That's a two-way thing. I'm sure your students gain a great deal from the placements that they go into, and that's absolutely as it should be. But to ensure that the kind of risks against unintentional harm are mitigated, and to ensure that the kind of the net benefit is equal on both sides, is relatively hard to achieve, but really kind of very important, I'd say.
Well, I definitely agree. And we look at teaching hospitals. So KCMC is a teaching hospital. So they're used to having.
Is it?
Yeah,
is that
the Kilimanjaro Christian Medical Center.
Yeah.
Well, it's my second home, yeah. Moshi. I love it very much. And we've hired some of the people working in the hospital as faculty, and we've flown them up here and all over Europe to teach. So we found that it is very much a brotherhood and sisterhood, instead of just gimme. Let me put my students here. Mm-hmm. So, and Tanzania is a fantastic place for it.
Yeah, absolutely. How's your Swahili?
About as good as my German, so pretty rubbish. But we set up language training for our students before they go. Yeah.
Brilliant. Good. Yeah.
So we've talked about various things, but we need to talk about the elephant in the room. So we met because of the DTN, the Diploma of Tropical Nursing, and you were kind enough to allow paramedics onto your program. But tell us about what is the DTN, and what does it benefit the paramedic, the nurse going through it?
Yeah, well, the paramedics were kind enough to come, so that's been brilliant. The Diploma of Tropical Nursing, or the Professional Diploma of Tropical Nursing, to give it its full name, is a very well-renowned, long-running course delivered by the London School of Hygiene and Tropical Medicine. And its aim is to help prepare nurses and other healthcare professionals to work effectively in low resource settings or with underserved communities. So it's a funny thing, because it's not exactly what it says on the tin. It remains being called the Diploma of Tropical Nursing, but we have to recognise actually that's quite a colonial term these days. What is tropical nursing? It summons up images, doesn't it, of infectious disease and schistosomiasis and leishmaniasis and things, and that's absolutely what it does cover. So if that's what you're in it for, then that's what you get. But it's kind of tropical nursing is more than that these days. It's more of a diploma in global health. And increasingly, I think we're all recognizing that we're all global health professionals. Every nurse that I know is a global health professional, because they treat a global population, because the world is so interconnected. There are marginalized groups everywhere in the world. So a number of our students, they live and work in London, and and have no intentions of working internationally, but still find the course incredibly useful because it helps them, for example, serve their homeless patients or their migrant groups a lot better than they would otherwise. But nonetheless, usually the majority of the group of the cohorts are aspiring or already working in more international locations around the globe, including a lot in sub-Saharan Africa. So yeah, I count myself incredibly lucky. I must be the luckiest course director in the UK because I get to meet the sharpest and the brightest and the most wonderful, diverse group of nurses from around the world. And every way it runs on a Wednesday, and I look forward to every Wednesday. And at the end of every Wednesday, I can genuinely say I've learned so much, and better than that, better than the kind of factual knowledge that I gain, I'm thinking about something from a different perspective because of the perspectives that the people on the course bring. So it's just fascinating. It's just absolutely fascinating and important. And I think I myself did the Diploma of Tropical Nursing as a student I don't feel like it was that long ago, but it was 2015. And I've still got a really firm network of the people that I met on that course. I've employed some of them. I've been employed by others of them. And I still count a number of them within my close friends. And I think the interesting thing about it is that we went online on COVID and we realized that we had a much more global reach. So we stayed online. And I worried that would be lost, that kind of human connection and network. But it's amazing, actually. It doesn't seem to have been. And what we might have lost in kind of human presence, like physical presence next to each other, we've gained in diversity. And so now, I hear stories of people that have met up with their colleagues from a different continent. Occasionally I get photos that people send me where they've met up in Malawi, or they're doing a research project together in Nepal, or all sorts. So it really has a global reach, and very, very proud of it.
I finished my DTN 3 years ago, and I'm still getting text on WhatsApp, and
yeah,
it's fantastic that the global cohort of people that you're, and now it's of course multi courses, so it's not just the 65 people on my course; it's others as well.
Absolutely, and we're really looking to extend the reach. I think it's quite. It's one of those things. I think in global health, so often it's very doctor medical centric, and that is great. And my colleagues who are doctors are wonderful, but I think it has to be acknowledged that actually the role of nurses is very underrepresented in global health. So around 80% of professional healthcare globally is delivered by nurses. Like, just let that sink in. That is enormous. Nurses should be everywhere. They should be in politics. They should be in leadership. They should be in research. They should be in LSHDM. But they're often not, not to the degree they should be, given that the amount of healthcare that they contribute to. And so I feel very strongly that the PDTN has a role there in advocating for nurses, in promoting nursing, and in connecting nurses, kind of in solidarity. I know I've mentioned the word nurse a lot now, and it caters for all kinds of healthcare professionals who are also very, very welcome to the course, and there's a lot of overlap. But nursing is really at its core.
I would like to see all paramedics take the Diploma of Tropical Nursing. It made me a better medic. I learned things that I did not learn in other tropical medicine courses I've taken. And yeah, I think so. Speaking for paramedics, like there's not a lot of trop med courses out there unless you're a doctor, and there's tons of them. So you are offering a fantastic tropical medicine course from London School of Hygiene, tropical medicine. It's like the Cambridge of all tropical medicine training programs. I mean, it's the best of the best. And you're offering that for medics and other allied healthcare providers. I think it should be mandatory for any paramedic who wants to go out and do remote work or offshore work or austere or expeditions like yourself. This would make them better.
Oh, well, that fills my heart with glee. What was particularly useful for you when you did it?
I liked the fact that I was learning Trop Med again, but I was learning it from the perspective of a nurse, and the lectures were from nurses, and like, okay, this is severe malaria. Okay, how do we take care of severe malaria? So what do we need to worry about with okay, can they swallow? That's severe malaria. If they can't swallow it, and the treatments are different. But as a nurse, how are we going to affect that? When I have attended other tropical medicine courses that are focused on doctors, they couldn't care. What drug do I give them? And I'm going to just move on.
No, absolutely. And I think we're all about putting nursing at the centre. Putting nursing at the centre of the programme is all about putting the person receiving treatment at the centre of the programme. And there's a temptation sometimes when you've got courses that are delivered by on a medical model but are for nurses, is that it's kind of what the medics get, but an easier version, which I find very offensive because nursing and its overlap with other healthcare professionals isn't just a miniature version. Is it? It's a slightly different focus. So actually, so much of what we do on the PDTN now is about supportive care. Actually, yes, diagnosis is important, but actually for so many conditions, the diagnosis is just a small part, because what you do with the person in front of you is treat what's going on for them symptomatically. Supportive care is enormously important, and that's the thing that really saves so many lives. I'm really glad to hear that that perspective was not lost.
I also I added on the laboratory diagnosis short courses that London School offers, because I needed that hands-on. I'm a knuckle dragger, so I just need to get my hands on to things. And I came for the malaria lab, and of course you have a 5-day parasite laboratory as well. And I think the malaria used to be part of the DTN program, wasn't it?
Still is, absolutely.
Yeah. And how the DTN is taught virtually with lab work is world class. I mean, what? Yeah.
That's all thanks to my colleague Claire Rogers, who is the most exceptional educator I think I've ever met, and she's such a natural as well. And I met Claire when I did my own PDTN, when it was in person in the lab. And probably like you, I thought, well, how can they possibly deliver that online and it be as effective? And wow, like what she does is just incredible. And the level of detail and the care that is taken to ensuring that it's as close as possible to being in a real lab as could be is really impressive. So yeah, shout out to Claire.
Yeah, I was in a 5-day class with her, and I saw a little beam of light hitting her on her head as she walked around. She was just golden, absolutely fantastic. So great to have her on the DTN. So we talked about the DTN, and I want to know that now that you've been in the chair for almost a year, where do you want to take the DTN? What's the future of the Diploma of Tropical Nurse with you in the helm?
Yeah. Oh, the vision. It's an interesting one. So it's kind of twofold, I think. So in a soundbite. So I want the PDTN first of all, and I think we're a good way now at achieving that. But I want it to be synonymous with kind of innovation and excellence, really, in preparing nurses and other healthcare professionals to address those global health challenges. So I'd like to ensure that it's really got its finger on the beating pulse of global health, and that we're really truly reflecting the needs of professionals who are entering it. And that includes being up to date with kind of emerging threats and emerging solutions. So including themes such as AI and including themes such as remote support. The idea that the expert doesn't have to be in the room anymore is really, really important. We're kind of demonstrating it by going virtual. I've got a colleague that delivers nursing programs from the UK to nurses in Myanmar. and so there's lots of innovative ways of delivering global health innovations that can be hugely impactful. And I'd really love to foster that sense of innovation within the nurses. And I'd like also for really the PTN to just be the starting point. Like, it's this jewel, I think, at LSHTM, but there's so much more that nurses could go on to afterwards. So I'd really like LSHTM to be a nurturing ground that supports nurses and healthcare professionals to make that significant contribution to global health worldwide. So that's the blue sky thinking. As for kind of routes to getting there, I'm all about the kind of partnership working and the developing those links. So in the last year, we've held a series of listening events with people and organisations that we know work closely with our alumni to work out exactly what their needs are, and also with researchers within the field to try and establish pathways through to research, pathways through to kind of defined career paths within different sections. We're working on accreditation for our programme so that you could take the PDTN as part of a wider master's pathway, for example. So there's lots kind of in the pipeline. We're also working on establishing a couple of new kind of mini courses, which could either be for people like you, Aebhric, if you'd like to come back, have a refresher. There's a kind of 5-day course on nursing with limited resources. Ooh. Or a 2-day course on infection prevention control. Or it could be a taster, so it could be a kind of pipeline to the PDTN. Come and try these courses, see if you like them, and then come into the bigger awards if that's tickled your fancy.
I would definitely come back for 5 days of a refresher. Absolutely, any excuse to go through those halls. I would be delighted to learn about that. And the alumni program is very good. Like there's advice for graduates of the DTN program to get work with the MSF or World Health or other places.
Yeah, do you know that as an alumni of LSHTM, you get access to the careers service? I think it's for 2 or 3 years after you graduate. So yeah, and I actually myself, I mean, I find it ironic now, like they didn't advise me to apply to be the course director of the PDTN, but that's a very specific job. But I made the most of that careers service, and it was really interesting in opening up some pathways that I, even after doing the PDTN, didn't necessarily know were an option for me. So yeah, the careers goes, but also the kind of family. I think it's one of those things that you meet someone else in life, you happen upon someone else in life that has done the PDTN, and you automatically have a bit of a bond with them. Do you feel the same?
Yeah, definitely.
You've automatically got that common ground, haven't you? Yeah. Kind of a big family.
Oh, so Katie, my final question for you is this. What advice do you have for the new medic, the new nurse, the new doctor who is just starting their career in austere medicine?
Think critically about what you're doing, but not so much that it impedes action. So it's really, really good to be cynical about opportunities, but sometimes cynicism can be disabling, and it means that actually you end up doing nothing. So, do think about how you're going to mitigate the risks of unintentional harm, but don't let doubt stop you from doing things, because, the time is now. There's never a good time to make a big decision, but sometimes it's really, really worth it.
Starting out brand new as a nurse or a paramedic, you have the risk of freezing on that first major decision.
That's it. Yeah.
So yeah, think critically, but not so much to the point where you're frozen.
Yeah.
Good advice. Katie, thank you for the path that you walk. You are making the world a better place in the work that you're doing. Well, as your own path, but the work you're doing with the Diploma of Tropical Nursing, and thank you for that.
Thank you so much for having me, Aebhric. It's been lovely.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.ca. mt.